What I think is missing is an interactive discussion about what these particular posts mean. And again, the way that I come up with this is I'm looking for specific, interesting articles that are related to vitality that are based in peer-reviewed published stuff. So this is all papers that have been published within the last 2 to 3 months. And one of the most interesting ones is this one. And I titled the post on Vitality Explorers, and please share that URL with as many people as you can, because our goal is to grow our community, to grow the group, and long-term to help each other lead our most vital life. So what to eat and drink to live longer is something that a lot of us are interested in. And a lot of people have asked the question, can you drink alcohol? And what can or should you do? And this question is becoming more and more interesting and a little more complicated based on the science of organ aging. So people know what their chronologic age is. You obviously just look at your birthday, look at the calendar, and that's how old you are. There's a ton of different ways to measure what we call your biologic age. And your biologic age could be measured by your genetics. It can be measured by the proteins in your blood. It can be measured, actually, interestingly, by the back of your eye, your retina, how your skin looks. But what's fascinating is that the inside of us, our organs are aging at different rates. So this is really super cutting edge science. Okay. And again, you guys know that I'm a little bit of a geek about this, but I think this is important in the context of what we eat and drink. So this paper, again, published this year, looked at things like smoking. Okay. Now it's obvious smoking is pretty bad for you. And then they broke it down by your lung, immune system, brain, liver, kidney, intestine, and your arteries or your cardiovascular system. So it doesn't matter which organ system you're looking at. Smoking is clearly bad for you. And I think that's an interesting place to start, because I don't think there's any debate about smoking is bad. So if you're a vital person, you should stop smoking or never start smoking. Where it becomes a little more complicated is drinking. All right. And when you talk about drinking, and again, I think I should pause for a second because the details are important. The system that they use to measure how quickly your organs are aging is related to the proteins in your blood. And they used a large database, something called the UK Biobank. There's over 53,000 people. They tested a lot of different proteins in their blood. And then they looked at, okay, on an AI machine learning algorithm, they figured out what are the people who have the oldest looking kidneys, arteries, brain, immune system, lung, and liver. Okay, so the major ones looked at. And then they started looking at, if you were, this database has, do you drink? How much do you drink? How much do you exercise? Things like that. And they started looking at what does, say, your intestine look like if you're a drinker versus not a drinker. And this is the effect per gram of alcohol. All right, so it's pretty clear that drinking is not good by their model, by this paper. And by the way, when we talk about science, one of the things that's interesting about science is really never solved. It's always evolving, right? So the science of whether drinking is good or bad is not, it's never going to be as a good or bad for you. It's going to be the evidence points to this part of it being good or bad for you. And that's why I think we should talk about it, because it's interesting. If you're drinking, every gram of alcohol you consume makes your kidneys or your intestines appear to age faster. It appears that your cardiovascular system, it ages slower, brain faster, immune system and lung a little lower, and maybe these other ones, really the lower ends of it, doesn't make a big difference. So it's pretty clear that it's a mixed bag. Interestingly, when you look at the things that are good for you across the board, all of them, being good for you, is, and I had to look this up. This is where I want Sally to talk about. Muesli is like oats or something like that. It's like I don't really know exactly what it is, but if anybody has any specificity, that'd be great. Oily fish, raw salad, and red wine seem to all be pretty good for you in terms of slowing down the aging process. The final thing here is to look, and this is not good for the men who are listening here. It looks like in the model that they're doing across the board, and it's not huge, but this partially explains why maybe women live longer than men, is that we tend to, by our organ systems, all age a little bit faster than men do. Okay, So when we're talking about, okay, so I think, thank you, Sally, for putting it in the chat there. Yes, so I do like oatmeal. I don't know how much different it is than oatmeal, but we'll get to have a little chit chat about this one. But I think the open question would be: is it still bad for you to have a glass of red wine once in a while? And my filtering down of all this is it's okay to have a glass of red wine once in a while, unless you have some issues with your kidneys or your intestines that might put you at a higher risk. Okay, so when we move on to the second one, and I tried to choose ones where big impact, new research, and some specificity of what can we do about it. And the second one that I chose here is 6 months to a sharper mind. By the way, these are also the most popular ones in the last couple of months in terms of people who have viewed them or commented on them. And this has to deal with high intensity interval training and how it can lead to better brain function. Now, we know that exercise matters, and any sort of exercise is important to keep your brain sharp, but what and how much? And also, what is a marker for a better or a sharper brain? And something called BDNF, that's brain-derived neurotrophic factor, is one measurement that you can do in your blood that is indicative, maybe, not 100%, but maybe of how well your neurons are working, how well your nervous system, how well the connection in your brain is working. So when you look at this graph, and again, I never try to insult my audience. I try to level up my audience to the science. So this particular graph basically shows, shows that in green here, this is low intensity, and I'm going to define these in a minute, medium intensity interval training and high intensity. So the low intensity, and the interesting part about this particular study, and again, all the data and the references are on the Vitality Explorer Substack site. And the most important part about this study was that this was supervised. So this wasn't somebody journaling it. These were people going into a clinic and actually doing these kinds of exercises. So the low end, and they were all about 40 or 45 minutes, 3 times a week. I'm pretty sure that was what it was. And this was for about 12 to 16 weeks to begin with, carried out to 6 months for the first time point, and then all the way out to about 5 years. But what they looked at in the low intensity exercise was basically keeping your heart rate around your 50%. That's stretching, that's doing types of yoga maneuvers, but no real intense exercise. The medium level was basically walking on a treadmill at about 60 to 70% of your maximum heart rate. And the high intensity was sort of toggling between 4 minutes at 90% and 3 minutes at 70% on a treadmill. So pretty high levels of exercise. And according to this chart right here, which you can say, is it looks like if you're doing low levels of exercise, it doesn't make a big difference in terms of your BDNF, remember your marker of how well your brain works. But if you're doing the other two, it's going to rise, okay? So it didn't seem to matter a huge amount whether you did the medium level of exercise or the high level of exercise, both went up. And that's, I think, interesting and important data, okay? Now, when you're talking about a sharper mind, there's a lot of neurocognitive tests you can do, and one of them has to do with, if you're asked a whole bunch of questions, how many errors do you make in these questions? You know, these are matching questions or remembering questions. So in this particular case, lower on this chart is better because you made less errors. And if you look at this, this is where it starts to fall into the category of the high intensity interval training is better. When you see this right here, over the course of 6 months, the number of errors went down significantly when compared to the other two types of exercise. And this is what's interesting, is that was carried out all the way out to 6 years later. Okay, they only were in a supervised situation for 6 months, but their level of brain function in terms of less errors, okay, was better all the way out to 6 years. Massively important piece of data. And they did, in a subsection of the people in the study, they looked at neural connections between a thing called your hippocampus, which is in the center of your brain, and they were improved only in the people who were in the HIT group, the high intensity interval training. So let's finish with one last one. These are all a little bit connected to your brain and your longevity. And these are, I'm playing around a fair amount with AI these days in terms of images. So these are me typing in, sort of image things into an AI and coming up with some visual version of how the more fat you have, your brain's going to start to shrink. But being obese this is important, being obese causes a 1.6 level increase in the risk of dementia compared to non-obese individuals. And this is what they were looking at in this larger group of people, was something called visceral fat. So visceral fat is two things. One is the fat between your skin and your abdominal wall. Okay, that's your subcutaneous fat. And then between your abdominal wall and around your organs, around your kidneys, around your liver, around your pancreas. And in this particular image, it's the organ fat is green, and the blue purple is your subcutaneous fat. So this person has a fair amount of organ fat. Okay, and again, this is all, what I really want to emphasize is this is new data. This is important data. This is hopefully actionable data, but it's not necessarily data all your doctors are going to know. And here's the kicker. It wasn't true for everybody, but this is where being a woman is not as good as being a man, because if you had a lot of pancreatic fat, okay, it didn't seem to matter as much in the men as it did in the women in terms of loss of connection in their brain. So smaller hippocampus volume in women with higher pancreatic fat. So there are differences between men and women. And one of the studies that is interesting that isn't utilized very often is a DEXA scan that looks at your visceral fat. And the DEXA scan is typically used to look at your bone density, but it can also get your total muscle in your legs, your arms, and a calculation of the amount of fat around your belly, okay? So I'm going to stop it with that for right now. And